So today let us discuss physical activity. And physical activity, according to WHO, means that it's any bodily movement produced by skeletal muscles that requires energy expenditure. Yeah. So that means there is movement and there is movement of the muscles. Sorry for that. Yeah, so regular physical activity is crucial, very crucial for maintaining and improving both physical and mental health. Very much important. And it can reduce the risk of various diseases and illnesses and improve mood and enhance overall well-being of persons. Yeah, so both moderate and vigorous intensity physical activity improves. It improves very health very much. So popular ways to be active include walking, cycling, wheeling, sports, and active recreational plays and can be done at any level of skill and for enjoyment for everybody. So physical activity is beneficial to health and well-being, and conversely, we should note this, and conversely, physical inactivity increases risk for non-communicable diseases, NCDs, and other poor health outcomes. Yeah, so we have risks of sedentary lifestyle. Of course, a sedentary lifestyle, according to WHO, is any period of any period of low energy expenditure while awake, such as sitting, reclining, or lying down when you're awake. When you are awake, you're not talking about when you're sleeping or when you're in bed at night. So physical activity, physical inactivity, that means there's no exercises there involved. Physical inactivity is one of the leading risk factors for non-communicable diseases mortality. Yeah. So according to WHO, people who are insufficiently active have a 20 to 30% increased risk of death. Yes, compared to people who are sufficiently active. Very important. Very important to note. So we have benefits of regular physical activity, and we can categorize them according to the age. And we first of all we start with children and adolescents. Yeah. So for children and adolescents, it first of all it improves physical fitness of these children. It also improves cognitive outcomes. It reduces body fat, very important. Yeah, we may see it as obvious, but that is it. That is it. Physical inactivity increases, it really does the opposite. It really does the opposite, and it increases the body fat. So for this one, it reduces body fat. So it also improves cardiometabolic health and bone health, yeah, and mental health as well for children and adolescents. Yeah. So for the adults and older adults, what does it do? Yeah. Yeah, there's this incident hypertension. It's also increased. It reduced. It reduces risks of cardiovascular disease, mortality, incident, site-specific cancers, incident type 2, diabetic mellitus, and also risks of falls. The risks of falls are very much reduced. It improves mental health and also improves cognitive health for these adults and older adults. And then, when people are still progressing in age, there are these cognitive health issues that comes about. So um, if someone is actively physically active, then it is improved. The cognitive health is very much improved. Yeah, it also improves sleep patterns, especially for those who have sleep issues, insomnia, and the others. So if you increase your physical activity, that one improves automatically, yeah. And also the measures of body fat, also that one is improved, just like we mentioned when we were speaking about children and adolescents. So there's also this other category of pregnant and postpartum mothers. Yeah, these women, when they are physically active, they decrease the risk of preeclampsia. So preeclampsia is usually the spiking of blood pressure before delivery of the baby or before the labor comes or during labor or during pregnancy. And gestational hypertension is also, chances of it coming about is reduced. We also have gestational DM or diabetes mellitus. The chances are reduced. There's also this excessive gestational weight gain. This one is minimized also. The delivery complications are also way much reduced. There's also something called postpartum depression. The postpartum depression chances are reduced very much, and also newborn complications are very much reduced. Yeah, so there's something that I would like us to note better. Note better. For this note better, I would want us to know that nearly 1.8 billion adults are at risk of disease or illnesses from not doing enough physical activity. The question is, how much of physical activity are you involved in? What do you do? Yeah, yeah. So something else to note, any amount of physical activity is better than none. So those women, especially those who are at home taking care of children or babies and they are not going to work or they are not doing much, they think they are not doing much, but those movements they do in the house, within the compound, it's quite a lot. So any amount of physical activity is better than none. All physical activity counts. For those who have for 9 to 5 jobs and you choose to use the stairs instead of the elevator or the lift, you're doing a commendable job and well done and keep it up. So all physical activity counts. And people should know that all age groups should limit the amount of time being sedentary. Mm-hmm. Yes, and muscle strengthening benefits everyone. And that is it for now. Thank you for watching. See you on the next one. Bye for now. Bye.